Let us discuss some of the treatment policy of some of the commonly seen congenital heart disease. First, we will see the most complicated congenital heart disease, that is hypoplastic left heart syndrome. These children requires major surgical intervention very early in life, something like first few days after birth. Let us see the treatment for the another commonly seen major defect, that is transposition of great arteries. These children require treatment very early in life, something in the first 2 weeks of life. Beyond 3 weeks, they become unsuitable for surgery. Then other varieties which require, other condition which requires early intervention or early surgery is what is known as a total anomalous pulmonary venous drainage. These children require operation maybe in the first 1.5 months of life. The other conditions which require very early intervention or early surgery may be sometimes large ductus or PDA in premature babies, usually require ligation in the first few weeks of life. The other conditions like atrial septal defect usually requires surgical closure or non-surgical closure, usually during the preschool age or something like between around the age of 3.5 to 4 years. The other commonly seen defects like ventricular septal defect needs major operation, open heart surgery and correction of these defects, usually in the first year or in the second year of life. The other defects like tetralogy fallow requires operation usually in the second year or third year of life. So, in other words, the timing of the treatment for congenital heart disease or birth defect of the heart is most important. If it is done at appropriate time, proper treatment from a skilled hand, these children can lead a normal or better life. Now let us see the prognosis of these children with birth defects in the heart. The major birth defects in the heart, especially the cyanotic congenital heart disease, otherwise known as the birth defects in the heart which produces the mixing of pure and impure blood, if not treated in the right time, they usually causes the severe symptom and majority of the children die in first 1 or 2 years of life, and very few children are seen beyond the age of 10 years without proper treatment. Whereas the non-cyanotic or acyanotic type of heart disease, the children grow usually for longer time, and sometimes they can reach even adulthood without surgical treatment, but they usually causes some other problems in the lung and may lead to much more worse situation. So, whenever a congenital heart disease is diagnosed, we should take a proper decision when to correct these defects, so that we will give a best chance for these children to lead a better life or a almost normal life. So, what are the percentage of children who get this proper treatment? As I earlier itself said, in developed countries, majority of the children, they get the proper treatment at right time, whereas in developing countries, these children, only about 2 to 5% of children only get the proper treatment, and rest of the children are left to their destiny and untimely they die. The situation should be we should improve the situation by early diagnosis and offering the children with the proper treatment at right time. The important factor why only only small percentage of children get the proper treatment worldwide is because of several reasons. Number one, the lack of awareness among the public about the congenital heart disease or the birth defect in the heart. Majority of the people doesn't know that the children are born with the defects in their heart. Number two factor is the financial problem or the funding problem for operating these kind of children, because these kind of operations require huge money is involved and experience and expertise team is required, and so these are lacking worldwide. The other reasons are many misconceptions among the public mind about this congenital heart disease. So there are several reasons why majority of the children are not getting the proper treatment. So we have to collectively come forward, all government and non-government organization, in dealing with the congenital heart disease and give these children a better life and a life which is almost equal to a normal life. Congenital heart disease or defect in the children heart is not an individual problem. We should take it as a social problem itself, because if there is a child in a family with the heart defect, with the birth defect in the heart, that family has to suffer a lot, both socially, financially and many other aspects. One good thing about the congenital heart disease or birth defect in the heart is that it is not infectious, or it is not what is called as the communicable disease. It is sporadically happening. It is just by chance it happens, and these kind of defects are not seen in other children in the same family. So the best way is to prevent or to diagnose these problems very early in the pregnancy and terminate those kind of pregnancy where the defects are very major one. If suppose we can diagnose these kind of major heart problems in the fetus in very early in life, like before 3 months of pregnancy, then it's better to terminate those kind of pregnancy and go for the next pregnancy. And so that is one way of dealing with that. The other field which is catching up or under severe investigation are what is known as a fetal cardiac surgery, or to do the heart surgery during the fetal life itself, and then and modify these defects so that these children can lead a better life. Whatever may be, ultimate message is that congenital heart disease or the birth defect in the heart in children are one of the most common disease. About 6 to 8 children born for every 1,000 children born do have these kind of defects. These kind of defects today have got a best method of treatment. Most of them require expensive and complicated operation, but these children can lead a good life. I have personally operated thousands of these children. Many of them are leading good life. Some of them become even good sportsmen and even academician also. So one of the very unfortunate thing is that as on today, in major part of the world, these children still don't get the proper treatment and are almost neglected, and only 2 to 5% of the children in developing countries do get this treatment. And that's why we should make a different policy and evolve some methods to treat these children, so that these unfortunate children, all of them, get a good medical attention and are helped to lead a good life.